the biggest challenge is if you look at the last 15 years in healthcare, we have been talking about the topic of electronic medical records for a long time. First, we started talking about computerized patient records about 15 years ago. Then the market started talking about electronic medical records without really solving the issue of electronic medical records. The healthcare industry started trying to address an electronic health record, starting to move data between multiple facilities. And today we're talking a lot about the personal health record. But the reality is that today only about 8% of the hospitals have an EHR. And if you look at the area where the hospitals are weaker on automation, it will be on high acuity areas. As I mentioned before, ED, ICU, step-down unit areas, labor and delivery. So if I look at the challenges, is that this is probably a market that is very much driven by vendors that provide all those core components, and vendors that have not been able to tackle yet the high acuity, best of breed areas. So by doing that, by having a market that is driven by the HIS large vendors, hospitals have the limitation of not being able to cover those high acuity areas because there is not that much interoperability between the HIS vendors and those best of breed vendors like Clinicomp. And the lack of interoperability is not so much due to a technical limitation, but it's more of a political issue. The vendors that go into a hospital become very protective of their environment, and they usually do not let best of breed vendors or emerging technologies come into their organizations. They prefer to try to develop those products and push that technology to those hospitals.